I am the Director of Customer Success with Cloudticity, and today I'll be joined by Tim Pletcher to share with you all modernizing the HIE through the AWS services and ecosystem. So we're going to run through a little bit of the background of the Cloudticity and MiHIN relationship, the benefits of the cloud, the constellation of the entities and expansion, account structure within MiHIN, which now Velatura, the interop station and active care relationship service today. Cloudticity and MiHIN formed a formal partnership in 2015. At that time, MiHIN was at a point of trying to determine strategically how they would start to transform the modern HIE. So this partnership became strategically aligned with the efforts of thinking big, making sure that they have ultimate security certifications that are needed and required so that they can quickly be agile in accomplishing business goals and ultimately improving interoperability. Cloudticity is a managed services provider that is a premier partner with AWS and uses next-gen automation and AI apps to help support organizations with their high-trust certification and compliance, and helps to also provide hands-on services such as migration and other specific professional services needs within the AWS environments. Now, as MiHIN and Cloudticity formed their relationship, MiHIN had quickly realized the benefits of migrating to the cloud allowed them agility and the ability to take on unexpected challenges, to stay mission focused without falling behind, to save cost and time, to have high performance, durability, and recovery. Now you all are going to see in a little bit as Tim shares with you the journey that since 2015 MiHIN has been able to recognize, but they've been able to accomplish enormous growth and have really ultimately challenged the way that HIEs perform today. As a major source of innovation, Tim will be sharing with you some of the different amazing things that MiHIN and Velatura have been working on and accomplishing. So I'll let him share some of that with you today, but here are just a few of the bullet points that he will be discussing with you today. So with all due respect, Tim, I will turn this on over to you.
Thank you very much. So this, woohoo, yeah. Hey, so this whole story that I'm going to tell you about is why you go to the cloud. There's a reason. And we made the cloud decision, which some people have yet to make, shockingly. Terrifyingly, they haven't made it. And we went all in. And we have never looked back. And frankly, we wouldn't have been able to grow the way that we have without making that cut. So I'm going to talk to you a little bit about 4 distinct products, none of which were really here when we started the journey. And I'm going to kind of tell how we kind of incrementally did things, why picking the right MSP is critical, because you need somebody who gets your business. Not everybody understands healthcare, and yes, healthcare is special, healthcare is different, ranging from, hey, that whole HIPAA thing, to all of the changes that we're doing as we go forward. So I'm going to highlight a little bit about Meld, which I'll talk about, open source platform, some spaces around interoperability land and using marketplace, some opportunities where really getting folks to donate data so we can understand a lot more, so we can teach things like APIs. Everybody wants to do APIs. Not a lot of our tech teams actually know how to do that migration. And really setting in motion ways for people to learn and think in a brave new way as we embrace FHIR and sort of the world upon us. So real quickly, history. The Michigan Health Information Network was started well over a decade ago. It was one of those HIEs that was funded originally by the Office of the National Coordinator and as a state focus. Just trying to get stuff to happen in one state in little old Michigan, which is about 3% of the population of the country. So it's tiny by comparison. And we did all the normal things that you do back then of having our own data center, renting space, et cetera. And in 2015, we went out, picked an MSP. We picked Cloudticity because they had the best healthcare understanding. And since then, it's been like a rocket ship going forward as we tried to do new things. Fast forward to today, we're not just worried about Michigan. We also have an entity that is doing things in 15 different states. And we have a sort of innovation and research institute called the Interoperability Institute, which is really worried about standards development, educating the new workforce, and the use of synthetic and simulated environments to have sandboxes so that we can actually accelerate learning and adoption inside of our companies. Now, what that looks like from a corporate structure is multiple entities. Multiple entities growing up in a traditional non-cloud environment are hard. You can't spin things up or spin things down with the sort of way you need it. You can't draw security boundaries the way you can in the cloud for each of the different entities, because each entity has their own slightly distinct mission. And so if you look at this little picture, there's 1, 2, 3, 4, 5, 6, 7, 8 companies with many more to come that we're essentially rolling up and putting together and managing. We do that all in the cloud. We do that across multiple geographies. And what we've really had to do is structure our account management mechanism to be able to handle those corporate boundaries, which groups are nonprofit, which are for-profit, the different data sharing agreements and different kinds of use that organizations expect and want. And we've really had to work with our MSP to set this structure up so that it works and fits as we do things in different states. One of the things that's really interesting over the last 2 years is we've started another company called Velatura HIE Corporation. And if you are familiar at all with the HIE space, there's massive consolidation beginning to happen in that industry. But weirdly, they're all nonprofits, and they're scattered across different states. And Velatura HIE Co. is really positioned to take this market that is somewhat mature and really position it for growth through sort of consolidation. The other corporate entity that we have is this Interoperability Institute. And the Interoperability Institute started off really because we had many interns. We brought them in, we trained them, we got them good jobs, and one day I looked around and we had 80 interns in our corporation. And we went, this is an HIT workforce program, and we moved that over to the Interoperability Institute. We moved all of our agile software development groups, so there's 5 agile software development teams, and we took all the IP that we'd built over the handful of years to do simulated data and onboarding and accelerating companies to share data, and we put it into this interoperability land sandbox, which has recently been converted to MELD. MELD is a total open source platform where we forked the Logica tree, brought all of the things that we learned over the last few years for doing synthetic data and simulated data, and have now really set up this interop.doc community to be able to foster how can we all have a standard sandbox? Weirdly, everybody talks about wanting to adopt standards, but they have their own special sandbox that is totally unique and custom to their own shop. It doesn't even match their production side of the house. The idea behind MELD is to standardize on sandboxes, to standardize on the personas and the synthetic data, so everybody can compare apples to apples when we try to do new things. Now, one of the things that we really did and where the cloud works is you want to get your sandbox high trust accredited. You want it to be scalable and well managed in the cloud, and you want to be able to quickly flip it to your production environment. That takes a lot. The other thing that we also do in this space is we have another partner, also happens to rely on Cloudticity, also very focused on being cloud native, called Diameter, that has worked really hard to take data and push forward FHIR bundles. Those FHIR bundles really want to be published to a FHIR repository like HealthLake and consumed by something that can handle and take FHIR. We call that something the Interop Station. The Interop Station is something we never would have dreamed ago when we started, that helps health plans comply with their 21st Century Cures Act requirements for consumer access APIs. So we've got all this legacy stuff that we're able to bring forward and actually position the sort of requirements around Cures Act to help organizations participate in a real consumer-facing API kind of space, but do it in a way that allows them to start saying, oh, we care about health equity, we care about the Gravity Project for social determinants of health, and really create this layered mechanism that takes advantage of sort of cloud-native activity and microservices to stack things up. The last piece I'll mention, won't go into a lot of detail. I don't know how many people are familiar with graph databases and sort of their role in a lot of the AI and kinds of things that are coming. But we have this construct, a piece of technology called the Active Care Relationship Service. Currently lives on Neptune, if you're familiar with that graph database. And what it does is it allows us to collect the care map from everybody, and we do this in the millions now. Millions of these linkages for how patients are connected to other payers, other patients, what EDs they've gone to, are they in a foster care program. Also collect patient choices, so where is their advance directive, what are their e-consent preferences, as well as a lot of the insights that are happening from a lot of the data mining, analytics, machine learning kinds of activities, which we call attributes, and really get what we refer to as context as a service, so that very few organizations can serve up as an API, here's the context for the person you're looking at. And behind that context are pointers in the form of endpoints that allow you to go get the data if you care about those particular attributes. All of that was not even remotely possible without sort of laying these foundational components on a cloud-native infrastructure.